All right. Happy Monday, everyone. I am so excited for you to be here today to meet and hear from the beautiful Dr. Richelle Knowles. If you are a chiropractor, I know you know in our profession, she requires no introduction. But for those of you who do not yet know her, you are going to be so blessed by these minutes that we have with her. Thank you so much for being with us here today, Dr. Richelle.
Oh, thank you, Dr. Lauren. And I want to say ditto back to you because whoever's here I've been blessed by you. So whoever's on here will be blessed by you as well.
I can't wait for it. We're here to be a blessing, aren't we?
Absolutely.
And you have been in private practice at Network Wellness Center is the name of your clinic in the Boulder area since 1999. Is that correct?
Is correct. Mm-hmm.
Wow. Wow. And so you've been in the trenches, hands-on patients for a very long time, building a large team of professionals who we know serve the local Boulder area, and give us a little more insight about that.
Sure. So my husband and I have practiced together in the Boulder area for 25 years. We absolutely love it here. We love our community. And I just love getting to work with, families and people of all ages to just really help them get more out of life. We really focus not on how to get less of something, but on how to get more of something to help the nervous system be more adaptable, to help people reorganize better, to help people adapt to stress. I mean, as we know, the world is a crazy place and we have more stressors coming at us than ever before. And it's just really amazing to see people function better and have a healthier nervous system. And it's been the joy of my life to do that, daily here in Boulder. So I was talking to my son, our son is in chiropractic school. And I was talking to him the other day and just saying, after 25 years, I love it even more today than I did the first day that I started practicing. And not very many people can say that about what they
Right
do.
now. I love it. I mean, so true. And I'm sure you can agree, could you agree that after all this time that, like you said, our patients, they have more coming at them than they ever did when we started practice.
Absolutely. I mean, you just think of the sheer amount of information
Mhm.
that people have to assimilate. We always talk about, people need to update their phones, right? Like you always need to do an update or you need to upgrade your phone or whatever, but we don't expect to do that with our bodies and with our nervous system, with our health. I know you know this, I'm preaching to the choir, but it's so important to
Mhm.
update and upgrade, your health and your
For
body.
sure.
So,
I
mhm.
always love the saying of, all right, you take your car into the shop, your car has replacement parts, right? Your body does not have replacement parts. You got to take care of the ones you got.
Right.
And I love how you said that there's so much coming at people and just sheer information overload of, um, the world of technology. Which, okay, look at this beautiful thing that we get to do today because of technology. There's so
Right.
many blessings, and there's so many other things that we both see affecting the neurological function of our patients who are, again, just really, would you say it's overstimulation?
Oh, absolutely. I mean, like you said, this is a huge blessing. And also, like example, our kids, you can keep them away from things as long as you can, right? But ultimately, they fall into the
Mhm.
social media. And my kids really haven't gone that deep into it, but you're seeing how it's affecting the health of our, especially teenage, young, early 20s, women
For
that have been
sure.
so
Yeah.
affected by all of
Mhm.
this. It's a good thing. It gets information out. It allows us to connect. And then also there's a lot of detriment to it. And we need to help support people to be able to adapt in this ever changing world. So,
So good. And I mean, is that not just exactly what chiropractic care is? It makes us adaptable,
amen. Amen.
right? Right. I know. So if you haven't tried chiropractic, oh my goodness, you guys. And if you're in the Boulder area, we're gonna provide information here in links where you're gonna be able to find Dr. Richelle and her team, her her husband, Dr. Danny Knowles. I mean, they're an incredible team resource for you if you are in this Northern Colorado area. Now, the segue with that, you guys, is not only does Team Knowles serve the public, but they serve the fellow practitioner. They serve their colleagues on a different level. So that what I look at what you guys are doing, Dr. Richelle, is when you serve us, your colleague, you make us better able to go into the field, into the trenches, back to our neck of the woods, wherever we all are across the country, and be able to better serve our patient base. Now, can you tell everyone about what you and Dr. Danny have coming up here? Just at the end of this month, they have one of the biggest national chiropractic conferences in the middle of the continent instead of going all the way to the one coast or the other. It's amazing because they're right here in the Denver area, called the Mile High Chiropractic Movement. So can you tell us a little bit more about that?
Absolutely. So it's coming up, like you said, the end of the month, September 26th to the 29th. It's called Mile High. It's a chiropractic movement weekend. This is the 12th one, which I can't even believe it. It literally started out because we wanted to just have like a flagship event to get chiropractors in this region of the country together and to bring in speakers to help fill them up and to help them be better at what they did, right? Be better practitioners. And so what kind of started out as a labor of love, it's still a labor of love, right? But it's grown a lot. And we have people come in from all over the country and some from all over the world too, which is pretty amazing. And it's just, it's like fuel for your soul. I guess that's a good way to put it, right? It's like you get to be around your friends, your colleagues, people that you've never met before, but maybe you've met, like we were just talking about these platforms, right? Yes. And just to refill your soul. And we didn't want to just be like a hype fest, where people came and it was rah, rah, and then it was empty and then they left and things were the same in their life, right? We wanted it to be that the content was so rich and that there was stuff about research, that there was stuff about, health freedom, that there was stuff about, chiropractic practice and all these different things, and also practice building and all, business stuff. So, and philosophy, and kind of bring those all together. And we have a really good time doing it, right? So we all get together. It's a great weekend, and we're just super excited and really excited. Can't believe it's the 12th year, and we're already talking about the 13th year. And I'm like, wait, how did that happen? Time.
Yeah, for sure. And David and I were one of your original gangsters. We've been there since day one. And I mean, so yes, it is like you just said, there's a time and a place for the rah, but none of the rah stuff fulfills us if we didn't have action tools to take back to make everyday practice either easier on us as humans and more effective for our patients. And I can attest that that's exactly what your I call it a seminar, but your event is content rich in multiple facets. So no matter what a doctor of chiropractic running a practice needs, they're going to get nuggets from different categories that make a chiropractic office successful.
For sure. And it's for doctors in Colorado, it's easy to get to, right? And for other people, it's in Denver, right? It's in Thornton. So it's right off I-25, super easy. But then Denver's a hub for flights. So that it makes it easy for people from across the country to get into.
So easy. Exactly. You're able to cater to people in the Midwest, but also East and West Coast, because they're not needing, 3 connection flights to get to Denver. Everybody can get to Denver so easy.
Yeah. Which is great for us too, because we can all fly out pretty easy, right?
Correct. Right. Absolutely. It goes both ways for sure. Well, and so with that being said, here we are. We're both women in the profession. We've done the hard work of building the clinic, of growing a team, of all the things that it takes to help people. You got to tell them that you're there, and you got to market. And I mean, anything that there's so many wheels moving for the small business owner, specifically the clinic owner.
Right.
And if you could speak to to us, Dr. Richelle. Could you speak to the ladies in chiropractic? If you had a piece of advice that you would give to them, what would it be?
Right. So you and I are both fortunate to work with our spouses, which is incredible, right?
Yeah.
So I feel super blessed for that. And I think chiropractic's such a great profession for women. It's really shifted over the years. When I went to chiropractic school 28 years ago, which is like just blows my mind. It was like, I always say it was like walking into a monastery because there were like no women. It was all men, and then like, I mean, I don't know percentages for sure, but I would be surprised if it was 20%. I really
Got
would.
it. Wow. Yeah.
And then, and like I said, I don't know numbers, but it was a lot. It was more male dominated, and I love guys, so I'm not, but it's
Right.
really
Yeah.
because it's I love about it is that being a small business owner isn't easy, right? Like I'm not going to sugarcoat it. And the cool thing about what we do is you can craft your own hours, right? And like I look at what you've done and what you've created over the years, you can craft your time so that you can spend time with your kids, so that you don't miss things, right? That you have hours in the morning sometimes and afternoon sometimes. And so I think that it's beautiful. Number one, you're being your own boss, right? And number two, you can create the hours that work for you and your family. So it's such a great career choice for women. And like I know you've gone all online, which is awesome. And even if you aren't all online, but you're here, it's just you have to be in person in the brick and mortar. It's such a beautiful thing, right? It's like you can do a shift and then even if it's not, you don't have to work from 7:00 in the morning until 7:00 at night,
Right.
every
No.
single day of the week. You can go into group practices and people do split shifts. There's so many cool things that you can do. Like for us, we have a 3-day weekend every weekend, and our team loves it, right? Like the 4 days that we work Monday through Thursday, they are long days. But then you have a 3-day weekend. By the time Sunday rolls around, I'm like, when are we getting back to the office?
Right. Yeah.
So,
you literally have the time to fill your cup. And I mean, and it takes that to literally put hands on people, or in our virtual space, just to give attention,
totally
the attention it requires to serve the people in the way that we expect our care to feel, right?
Yeah.
It takes a ton of energy.
Right. I mean,
mental and physical.
Right. Yeah.
Right. I mean, you're on. You have to be on. The patient will not feel like they're handled, like you handled their concern, unless that's the case. And so I, like you were just saying, either, perhaps knowing your own rhythm, and maybe knowing your household's rhythm, your family's rhythm. And that's always been a beautiful thing. I've seen that over the years with doctors all across the country that I've known, where it really does, they really have the ability to set up the schedule exactly what works in their life. And like you said, and it has changed. I know it has. I realize it has. But like you are describing, maybe it was only 20% women when you were there, and we got to school. Gosh, what year did you start school? Did you say?
I started in 96. So I believe it was 96. Yeah, 96, 95 or 96.
Okay. So then David and I would have started 8 years later, and it maybe was 40, 60.
Yes.
Women wise, when we started. And now you just see, I mean, think of the skill set of women, the nurturing, right? Like, I mean, honestly, women, you're born to do chiropractic work. You're born for this. Like it wouldn't be outside of your natural, just our natural, what am I trying to say?
Like innate ability.
Right? Yeah. Our innate ability to care. And then you have the ability to also tweak your business lifestyle for having a family.
I know, it's beautiful. So it's beautiful. And really, it's just like everything else. You can set up the life that you desire, right? You can make it. I mean, yeah, and when I say that, people go, oh, can I work like, 8 hours a week? You can, right? But you have to work hard, right? I'm all about, it's like, I'm okay. And I'm also okay with working smarter and not harder all
Yep.
the time.
Yeah. I mean, it's a delicate balance there,
Mhm.
but anyone who thinks it's going to be a cakewalk, we're
Mhm.
here to pleasantly burst that bubble over it's hard, but very worthwhile work. And
Absolutely.
I mean, I don't think that if you go into any other doctorate program or what, it's going to be hard work. So it's
I,
just, there are
anything
some,
that you do that's worth it is,
yeah,
right? Like anything
right,
that you do that's worth it is. So it's
yeah.
just a blessing.
Yes. And so what made you and Dr. Danny go from private practice for, was it at least a decade before you started Mile High?
Yeah, it was. I mean, we did a lot of other things in the profession as well. Like we've served on different boards and we've taught network spine,
Yes.
which is the work that we do.
Yes.
And so we had done those types of things. I would say when our kids were really little, we were mentor coaches for our mentor. So we helped other docs, but it was all phone work, doing consulting and things like that, and helping them
Right.
like their practice. And it was, we loved it, right? And so like the more we got involved, the more we did, the more we were like, okay, like there was a calling for Mile High, right? There was a calling for us wanting to create a place
Yes.
for vitalistic chiropractors, that were looking to be real chiropractors and not be medical doctors. So that
Mhm.
that was the reason why we decided to start it. And it's, we do all those other things still, right? Like consulting and teaching and private practice, and Mile High is like one of the hats that we wear, but
Right. Yeah.
we love it. So, and
Which is,
yeah, it's like people say, don't, why are you guys still practicing? Why do you do this? Why do you do that? We love it. It's our life.
yeah,
We're not trying to escape from something,
right.
right?
I mean,
Like
can you ever imagine not giving the information to, right? Like, how are we all ever, there's too much suffering going on for all of us to not serve the public in whatever capacity our skill set is. I mean, I literally, don't you agree? Do you see many chiropractors like completely leave the natural healthcare space altogether? I just don't see that. They're
no,
writing books. They're doing, I mean, they're just continuing to give to humanity
absolutely.
because the need is so big. Just like you said, you saw the need for the
Right.
vitalistic chiropractor and you filled it.
Right. Yeah.
And
It's
so
amazing. Yeah. And like, I just want to give a shout out to you because I know how humble you are. So you'll talk about me the whole time. But from a personal perspective, being able to work with you, like I was doing all the right things, right? And I was like, let's talk about women. Perimenopause is real and stuff happens, and I'm eating right, taking care of myself, exercising, all those things. And I'm like, oh, what's going on? Right. And so I've been working with you since July, and it's been an absolute game changer. And so I just want to give a shout out to your
uh,
audience. Mine, who will be talking, is like to work with Dr. Lauren and her husband. It's been absolutely incredible. And I feel just in these last 2 months, I feel better than I felt in years. So I'm super grateful for the work
you
that you do.
deserve, oh my goodness, you deserve every win that you just listed. And I mean, it's just been my honor to work with you and to be transparent.
Yeah.
The majority of my practice is fellow female chiropractors.
Mhm.
Like when you look at your practice, Dr. Richelle, you're kind of like, maybe there's some intentional marketing. I love working with this group of people or whatever. And you see that fills certain chiropractic or, just offices. And for me, to be honest, it was a need of, I pray to be able to serve our lady fellow chiropractor colleagues who are, honestly, in my opinion, when I hear from them and I hear what they're suffering with in their own health, they are giving out of an empty cup. And
Yeah.
therefore that is not, it's not fair to them. And also it does hurt our client care.
Yeah, totally. I mean,
If,
the physician heal thyself. I say chiropractor heal thyself, right? Like you're doing all of these things to serve and help humanity, but even if you're doing some of the right things, there's even more that you need to do to support your health so that you can serve on a higher level. And so
correct, because again, I keep going back to the energy demand. You
yes.
give too much energy every day for how many years, and you literally are going to end up with an empty cup. And so our profession is full of givers and lovers, and they just want to help. And we can do that to a fault.
Absolutely.
We can get to a point, and so that I've been so blessed in, and that's honestly partly why we went virtual, because the majority of our client was coming at us from all over the country. And we have the ability to serve them with the work that we do, regardless of if they're in person or virtual anyway. And so who finds us? It is our fellow, mainly female, not all female. I work with a lot of male chiropractors too. But, the female chiropractor, she's like, I love what I do. I'm good at what I do. But this, or this holds me back. It's a business hit when we don't, I'm like, hey guys, you are a part of that business plan. What time, money, or energy are you putting in to fill your cup? And something that would take another 4 hours together would be to talk about the toxins that are hurting people's health, and how detox and all of that is so critical for optimum. Because if you look at the ways of our modern world, literally God only knows what's going into the water, the food supply, the cosmetics, the air.
I know it's pretty scary, right? It's pretty scary when you think about it. So we're battling against all these unknowns, right? Or I guess they're getting to be more known, but it's like, even when you do the right things, there's still things that creep in, and you've got to combat them,
Well, and a lot of people spend a ton of time, money, and energy doing a lot of good things, but something is making them hit the ceiling. And in my world, those somethings are parasites and molds and radiation and chemical and metals. And again, I just feel like we're the effect of I call it systematic poisoning. And I just feel like they're not even hiding it anymore.
No.
It's not even, it's just like, it's blatant. It's so in our face. Like, how can you not look at the back of so many labels did you see Time Magazine last week, Dr. Richelle, where they were like, maybe processed foods aren't that bad for you. Like, that's the kind of spin of propaganda to make the person go, hey, well, serve me another Mountain Dew.
Right. Well, I think also when you travel outside the country, you see like what's allowed in Europe and what's allowed here. It's totally different, right?
Totally.
And so the regulations, but I always also, yes, I like the research and the science and all that, but I also connect in with how I feel, right? So when I travel in Europe or Australia or New Zealand, and their stores are health food stores, right? All their stores, right? It's health food, right? And so like you go to New Zealand and you go, oh, I'm going to the grocery store, but the grocery store is what we call a health food store here, right? And then you feel so good when you're there, right? It's like the food that you eat, you feel nourished. It's just a whole different world. No gastrointestinal anything, right? And then like the minute you get off the plane, you're like, what do I, because it's just, you can have pasta and wine and not gain weight there.
Literally, you can eat your way through Italy and not gain a pound. And I jokingly, not so jokingly, see, things passed around on social media that says exactly that. You can eat your way through Italy, but you come back home and breathe the air and drink the water and have IBS and diarrhea.
Exactly.
Like, that's funny, but it's not, because that's true.
Yeah, it is true. I know.
Right.
And to make light of it it's so true. And it's like, I love that you're doing the work to help combat that for people. So it's really pretty.
But man, it's just like what you guys do. It's more of an uphill battle as we see all the things our patients, like I will say, it's hard. And maybe you say the word, it's expensive. And maybe you say the word, or it just requires good health in this country requires a lot of time, money, and energy.
Absolutely.
I mean,
and it's worth it.
It is worth it. It's the best money you will ever spend. And yet there's something going on in the food, water, and air that is doing that to us. We dream now of, again, European vacations. Sure, the sites will be nice, but guess what? I can't wait to eat.
I know.
Where I'm not going to get poisoned. And it's crazy. I haven't done a ton of international travel. It sounds like you have. And you would attest that that's legitimately true over when you're other places. You feel fine with no matter what you're eating.
Absolutely. So, and you know, I'm a cliche person, but all these things add years to your life and life to your years, right? Like that's what we want, right? And that's what we want for our people that we take care
I
of.
know.
So,
You know, I know. I feel it's our ethical responsibility, don't you,
mhm,
as doctors in the natural healthcare space to cut through the confusion. I completely believe that it's intentional to confuse the population. A confused population is easier to control. Also, a confused or an unhealthy population is easier to manipulate. And
mhm,
so, oftentimes, from a team building standpoint, like when I'm getting together and starting the day with our team, I mean, it's
mhm,
kind of like everyone asks, "Hey, what do you do for a living? What do you do? What do you do? What do you do?" Right? And I'm like, you guys, what do? We enable people to be healthier so that they are less easy to manipulate, so that they can make more choices out of information and not out of fear.
mhm.
Uh, I mean, isn't that just when you
It's
see
so
your patients? Yeah, when you see the
I,
light bulb come on.
it's beautiful. I don't know if you've ever been to Tony Robbins' program at all,
Oh,
but
I haven't.
yeah, it's so cool. We just went to Business Mastery, I believe it was in August, and he said, you know, what business are you in and what business are you really in? So what you just described, like what business are you in? People will say, "Oh, I'm a nurse. Oh, I'm an architect. Oh, I'm
Right.
this." And it's like, but when you do something as specialized as say both of, it's like just saying like, oh, I'm a chiropractor or I have a master's in nutrition, like for you I have whatever it is, like that doesn't tell the whole story,
Nope.
right? But how
Nope.
you described it, like what business are we really in, like that's what tells the whole story, and that's what people are drawn to because that's what you're passionate about and what lights you up.
Love it. Yeah. And I mean, okay, so what are we in business in? What would you say, right? We're in the business of, well, I like what you said earlier, giving life to your years and years to your life,
Yeah, yeah.
right?
I always say I'm in the business of more because I want to help people get more of something instead of less of something,
I love how you
right?
say that, like focusing on what we're for and not so much on what we're against,
Yes.
right?
Yeah.
Like, I mean, again, there's energies to that, there's
Right.
choices to that, and is the glass half full or half empty kind of,
Mhm.
games in our brain. Um, yep, that's so good. I know that when people feel better, when they have better expression of their nervous system, in my wheelhouse, when they're less toxic, you
Mhm.
just have a better you have your God-given expression. I was creating content for the business here this morning, and I after a church service I was at yesterday, where it's
Mhm.
like God designed you to be healthy. It is
Absolutely.
your birthright to have good health. If you
Mhm.
do not have good health, it's because of things of this world, right?
Yeah.
And again, I feel that it's our ethical obligation, our joyful obligation as doctors in the healthcare field, a natural healthcare field, to create better expression or give them the tools to have better expression. And I know you hear it too, where when XYZ symptom that they came to you for, yeah, we all get excited when symptoms go away, but then they tell you the real thing that they achieved. Oh my gosh, I rolled around and wrestled with my grandson this weekend, and my little girl who is nonverbal or whatever, she looked at me and said, "I love you, mommy," this weekend. I mean, we hear miraculous things, Dr. Richelle, don't we?
It's amazing. You know, it's all I just
It is.
feels as you said that because I don't think we know how far reaching we are, and all these little what people would call miracles, right? Like it becomes commonplace to
It's
us.
common.
Yeah, and so like I don't ever want to take that for granted,
No.
right? Like I never want to take it for granted. I want to celebrate because for us we might hear that all day, but for that person that we're
Mhm.
talking to, it's huge for them,
Yeah.
right? And so it's so important. I don't know. I love our people. I love our community, right? I love the women chiropractors. We and the guys. We have such a good group of people
I
that
know.
colleagues that we get to spend time with and be around.
It's so true. I mean, when we're saying our prayers of
Yeah.
gratitude, it's like, oh my goodness, our colleague, the networks we know, the seminars we attend, and when we're there, we know half the people in the room. I mean, what
Mhm.
a blessing of
Mhm.
of this career. So what I want to make sure it just is never enough time, Dr. Richelle. Never.
I know, we could talk forever.
We could. And so therefore, you guys, we will have Dr. Richelle back in the future because she has so much to give and to tell you here in the moments before we disconnect today.
Mm-hmm.
Can you just say the ways that someone could find you and your clinic for patient care, and how the chiropractors listening can be connected in order to can they still come to the Mile High movement?
Absolutely. They
Okay.
can still register. And I can also send you a link for like a coupon code or whatnot that we can put in.
Yeah, we'll put that in after the fact here.
They can still register. It's Thursday night, Friday, and Saturday, and then a day on Sunday where they can do more CE or a special program. And then it starts Thursday afternoon, the 16th or the 26th, I'm sorry. And then, finding me, Network Wellness Center in Boulder, it's boulderchiropractor.com. And I'm on Facebook, Instagram, all the things. So just look up.
Follow you.
Richelle Knowles to get in touch with me. But those are kind of the ways that you can work with me. So, and we also have lifetimewellnesspractice.com, which is our consulting mentoring program for chiropractors.
Love it. Thank you.
All kinds of ways to touch with me.
Yep. I mean, I always tell people, hey, is it low-hanging fruit or whatever, the easiest way, just follow me on social media. Then you're going to hear about all my other things. So but we will, don't worry. You don't have to have written that down, or if you're driving or something, we'll connect those links if you can just send those over to me.
Sounds
Dr.
great.
Richelle, thank you so much for your time here today.
You've been such a blessing to me, and I know so many others, so I'm super grateful. And also, people, if you're not working with her, work with her. She's phenomenal. So
thank you so much, Doc. It's my pleasure. Absolutely my pleasure. And everyone, check out. You haven't missed Mile High Chiropractors. If you've never been there before, you got to go and see what we're talking about. So thank you so much, Doc. Have a great day.
You too.